My name is Taylor Whitaker, and I will be helping present the concept analysis for nursing vigilance. I'll be going over the background and significance, the meaning in published works, and the purpose of a concept analysis. Firstly, the background and significance. Meyer and Levin defined vigilance as a state of watchful attention or maximum physiological and psychological readiness to act, and of having the ability to detect and react to danger. Vigilance involves meticulous observation and is the key component of caring and nursing, thus setting apart the field of nursing from any other profession. This concept of vigilance can go back all the way to Florence Nightingale and can be seen in some of her published works. It requires continuous mental alertness and readiness in order to act quickly in response to any threat. Its meaning in published works. Many studies have revealed that many of the health care errors that have occurred could have been avoided had professional vigilance been present. According to Meyer and Levin, some aspects of professional nursing vigilance include attaching meaning to what is, anticipating what might be, calculating the risk, staying ready to act, and monitoring the results or outcomes. The purpose of this vigilance concept analysis is to reveal knowledge and clarification about the term itself, as well as its relation specifically to the field of nursing. The main goal of vigilance concept analysis is to create knowledge, understanding, familiarity with the concept of vigilance in relation to the profession of nursing. Now, according to Chen and Kramer, some purposes of a general concept analysis include setting boundaries or limits to prevent becoming lost when exploring a concept, differentiating between two closely related concepts, examining the usage of concepts within existing writings, and generating research hypotheses, formulating nursing diagnoses, and developing databases.
My name is Caleb Harkins. I'm working with Montgomery and Taylor Whitaker on this concept analysis of vigilance in nursing. The first section I'm going to go over is definitions and defining attributes of vigilance. A preface, the term surveillance and observation are often used in the literature and by some nursing theorists to determine this, to tag this idea. We're going to call it vigilance for our purposes. Walker and Avant in 2011 described the defining attributes as the heart of a concept analysis. So that's what we're looking for here. In 2005, Meyer and Levin described vigilance in nursing as a state of watchful attention of maximal physiological and psychological readiness to act, and of having the ability to detect and react to danger. We took their article on vigilance and we found 5 attributes that they lay out, and those are, as Taylor Whitaker previously mentioned, attaching meaning to what is, anticipating what might be, calculating risk, staying ready to act, and monitoring the results and outcomes. So we took these 5 and synthesized kind of our own 3 defining attributes for vigilance in nursing. These 3 are utilization of knowledge and experience, physical and mental preparedness to act, and careful monitoring of nursing interventions. From these 3 concepts, we have synthesized our theoretical definition of vigilance in nursing. This is all based on vigilance in nursing in the acute care setting, just for this purpose. So theoretical definition is, in the acute care setting, vigilance is the nurse's utilization of knowledge and experience, physical and mental preparedness to act, and careful monitoring of nursing interventions.
My name is Richard Montgomery, Nursing 5120. I'm in a group with Taylor Whitaker and Caleb Harkins. We are doing our project on a concept analysis, and the concept we chose was vigilance. My part of the presentation is to present the cases. Our first case is the model or the exemplar case. According to Walker and Avant, they refer to the model case as the one that validates all aspects of a concept. Chin and Kramer also say that the model, or they also call it an exemplar case, conveys the statement that if it is not this, it is nothing. Then nothing is. If it is not this, then nothing is. So our concept of vigilance, we're going to present a model case that says, well, if this is not vigilance, then nothing is vigilance. We did a case that kind of establishes to satisfy all the requirements of both of the references, both Walker and Avant and Chin and Kramer. Here's our first case. This is our model case. A nurse with over 7 years of experience is assigned a new patient in a pediatric intensive care unit. The patient is a 28-day-old male admitted for an unknown illness and also feeding difficulty. Let's see, vital signs are normal for the patient's age and are ordered to be taken every hour with temperature every 3 hours. The patient has a peripheral IV and an NG tube for formula feedings every 3 hours. So the patient, nurse will go in there, take the temperature, and give the bolus feeding through the NG tube every 3 hours. The patient has an 18-year-old mother. She's staying the night and participating in the care, helping out with feeding, changing diapers, things of that nature. The patient's also being continuously monitored, available at the nurse's station with a continuous heart rate and pulse ox. The nurse, has had normal vital signs for the first 4 hours of shift. It's about 10, 11 o'clock at night. She goes in and notices that the child is not wrapped up really tightly in the blankets, and that the past 2 times she's been in there, that's been the case. So I guess the mother's been changing the diapers, hadn't swaddled the patient correctly. Patient's heart rate's gradually decreased. It was about 160. Now we're down about 130. Also, the temperature, while it's still in the normal range, it's 97.1. It was 98.9 a couple hours ago. The nurse recognizes this as possible deterioration of the patient's condition. So she turns on the heating lamps, also goes and gets some warm blankets out of the surgery suite next door, and swaddles the patient. Also educates the mom on proper techniques for swaddling and, good feeding techniques, changing technique, not exposing the patient to the cold can lead to a deterioration in the patient's condition. The patient had an uneventful night. Seems like a simple case, but it is a case of vigilance because what the nurse did was, even though the temperature was ordered to be taken every 3 hours, she started taking it every hour after she realized it was going down, just to keep a good handle on the situation, doing a little more than what was ordered or what was expected, what the doctor had said to do. And doing this, also she took a little initiative in educating the mother and making sure she was properly taking care of the child. That's our model of vigilance. It seems really easy, but it was as a result of the nurses using her knowledge and experience, which is a part of vigilance, to intervene and rescue the patient. And next, we have a related case. Chin and Kramer define a related case as one that's closely related concepts to the one we're studying, but is not exactly the same. Walker and Avant state that related cases have similar attributes, but are seen as different upon further analysis. We got a case for our related case. A new graduate nurse being oriented to the intensive care unit is caring for a patient on a ventilator. Her preceptor goes to lunch, and the nurse is paying really good attention to the patient. She's really caring for the patient, watching, making sure that everything's secure. While the preceptor is on break, the patient starts to deteriorate a little bit, starts coughing, pulse ox drops to 81%, still kind of dropping a little bit, and the patient's getting agitated, coughing a little bit, struggling. She doesn't know what to do. She knows something needs to be done. So she runs it down and gets another staff nurse who's a little more experienced since her preceptor's gone for a little while. They come in there, they suction the patient's ET tube, they increase the sedation a little bit, and everything's okay. Now that may seem like a concept of vigilance because the nurse was really right there on, participating in the care and monitoring her patient. She wasn't lacking in any of her as far as paying attention to the patient or caring for the patient, assessing the patient, that was all good. However, she did not know how to respond, so she had to go get help. So she didn't have the skills. She was a new nurse, not too far out of nursing school. She didn't have the skills to go in and actually do something and save the patient, rescue the patient, as we call it in the definition of vigilance. So this is actually an example of professional development. So she's developing her skills. So next time when this situation comes up, she can become vigilant. So next time she'll be vigilant because she already has some skills. The next time this particular crisis comes about. All right, next is a borderline case. Chin and Kramer defined a borderline case as one in which a word or concept is presented in a different context. So with vigilance, we have a case that satisfies that description. Now, so far, vigilance has been seen as like a positive, something that nurses do for patients, something that nurses can do to help patients, pretty much a good thing. It can also have some negative connotations when placed in a different context. I work in a local VA hospital, PRN in the ER, and when we work there, we frequently encounter veterans who have a diagnosis of post-traumatic stress disorder. So screening these veterans is mandatory, and it's really vital to early diagnosis and treatment. So every veteran we go and we screen them for any kind of mental issues, PTSD especially with the new all the veterans returning from Iraq and Afghanistan. So here's a case where a 34-year-old Iraq war veteran presents to the ER as anxious and upset. One of his chief symptoms is hypervigilance. Okay, so this is an example where it's kind of borderline. It is a definition of vigilance, but it's not nursing vigilance. He constantly looks around and checks for the nearest escape route. He's looking in his mirrors when he's at any kind of stop sign. He's anything he sees on the side of the road. He's thinking that it might be some kind of explosive. He is worried all the time. He also alert and responsive to any noises or interruptions to his daily routine, like just on edge all the time, but also very alert and kind of notices everything's going on, even if it's minor. He may turn that into something major. He checks the door locks at his home obsessively. He avoids taking the same route to and from work. Causes loved ones repeatedly to inquire about their safety. He avoids large gatherings, and he's very wary of strangers. The nurse recognized this as an extremely vigilant state, and that is one of the prime symptoms of PTSD, post-traumatic stress disorder. So what she does is nurse makes a referral to the mental health care provider on call to make sure that the patient receives appropriate care. The vigilant state exhibited by the patient does not relate to the definition of vigilance in nursing practice, but it is an example of, a textbook example of vigilance. The guy was very vigilant. All right, next is a contrary case. Contrary case, they're identified as those that are absolutely not descriptive of the presented context or concept. And they're usually pretty obvious to recognize as not something. Walker and Avant and Chin and Kramer both, expand on this by expressing that a contrary case often can, lead to a better understanding of a concept. So when we see something that's not something, maybe it gives us a better understanding of what something is. So vigilance, we're going to see something that's exactly not vigilance at all. So we're going back to a similar case to the original one, the model case, just make a few changes. We got a nurse with 3 years of experience. She's assigned a new patient, or he's assigned a new patient on a pediatric intensive care unit. 34-day-old female, admitted for unknown illness and symptoms of lethargy and poor appetite. So kind of the same thing as the first example. Vital signs are normal for the patient's age and ordered to be taken every hour with temperature every 3 hours. The patient has a peripheral NG and peripheral IV and an NG tube for feedings. The patient again has an 18-year-old mother, and she's staying the night participating in the care. Patient is being continuously monitored, heart rate and pulse ox from the nurse's station, also at the bedside. And the vitals are normal for the first 4 hours of the shift. The nurse notices that the patient's been poorly wrapped in blankets, kind of like the first nurse. This nurse, instead of saying something to the mom, she goes in there and keeps seeing the baby unwrapped, and she just thinks, well, I don't want to step on any toes. I don't want to upset the mom. I want to let her take care of her own child. And so she doesn't say anything about it. A couple more hours go by, and the heart rate's decreased to 138 from 160, kind of like in the first case. She just documents these findings and says, these are within normal limits. We hear that a lot in nursing and healthcare. What's in within normal limits? So she says, well, I'm not going to do anything about it. I'm just going to document it. It's within normal limits. No need to do anything. She's just ready to finish her shift and go home. She's tired. Then the patient's temperature had dropped from 98.9 to 97.5 over the past 3 hours. And she says, I'm only supposed to take it every 3 hours. So that's what she does. 3 more hours go by, and the patient has a temperature of 95.3, and her heart rate's dropped to 85 beats a minute. She's now struggling to breathe normally, and the nurse, she knows now this is a deteriorating situation. She's got 3 years of experience, so she knows when something's going wrong, when something has gone wrong. Alerts the physician. They do some emergency measures to actually take care of this child. If the nurse would have shown proper vigilance and used her clinical judgment to intervene on behalf of the patient, then this could have been averted. This case is, absolutely not an example of proper vigilance. That is actually an example of something that's happened in a place that I work. And so it's, real example of someone who was not being vigilant. They weren't breaking any actual rules. They were taking the vital signs as ordered, but if they'd have been a little more of a better patient advocate, more vigilant on their behalf, then the patient might have had a better outcome. Next is an invented case. Walker and Avant reference this. It's which a concept is presented outside of the normal context and kind of reads like a fictional account. They say, actually, in the book, it's sometimes like science fiction, something that would never happen, but sometimes it can give you a better understanding of your concept that you're studying. So since ours is vigilance, we got a nurse working on an intermediate care floor, like a step-down unit. They got a patient that's hypertensive. And so she says, I'm going to be vigilant, so I'm going to take his blood pressure often, every 15 minutes. So then she starts taking blood pressure when the patient's lying, sitting, standing, eating, drinking, using the bathroom, talking, sleeping, awake, before he has his medicine, after he has his medicine, before the medicine's had a chance to work. She documents all these findings meticulously and alerts the physician with every reading. This is an extreme and unrealistic example of vigilant nursing care. I mean, it's a totally invented case. No one would ever do this. It's the actual opposite extreme of vigilance. That concludes our cases. Thank you very much.
All right, the next sections we're going to discuss are the antecedents and consequences of vigilance. Chin and Kramer in 2011 defined antecedents as those experiences that you identify as coming before the concept. So basically these are the things that have to be put in place before vigilance can occur. The most evident antecedent to nursing vigilance is the nurse's knowledge and a nurse's experience. This is also followed by the nurse's resource, staffing, and other factors. We're going to call that the environment. First, we're going to go over knowledge and experience. A vigilant nurse must be able to assess their patient and determine what is happening in the current situation and act accordingly. When compared to an experienced nurse, new nurses may not respond as quickly or as appropriately in inpatient rescue situations as a nurse who has more experience. And this is just on experience. If nurses have the same knowledge base, and though a new nurse may have that same knowledge base as a more experienced nurse, they probably lack the same hands-on experience, the same clinical expertise, if you will. The second antecedent after the education and knowledge is the environment. This includes nurse staffing, staff knowledge and education to pull upon, and hospital resources. Studies have shown that lower nurse-to-patient ratios increase patient outcomes in inpatient rescue situations, and we all know that. Resources available to the nurse, such as computerized monitoring, proximity to the patient, they allow a nurse to monitor patients more closely, assess patients quicker, and respond to any needs in a rescue situation much more quickly. Next is the consequences. Consequences of vigilance are based on the outcomes of patients after an adverse event. Now, when we're talking about nursing vigilance, it's difficult to measure the idea of a vigilant nurse. You can measure experience, and you can measure knowledge base, but you can also measure the outcomes or the consequences. So that's what we're talking about here. When the attributes of a vigilant nurse are applied, there is a positive relationship to the outcomes of rescue events. And the opposite is also true. When the attributes of a vigilant nurse are not applied, there's a negative relationship to the outcomes of rescue events. This includes, all the factors that are in place for vigilance to occur in nursing. Our next section is the empirical indicators. Walker and Avant, 2011, define empirical indicators as classes or categories of actual phenomena that by their existence or presence demonstrate the occurrence of the concept itself. So these are the things that we can grab a hold to, that we can measure, since vigilance is such an abstract idea. And since it is such an abstract idea, these empirical indicators are the same as our defining attributes, which are utilization of knowledge and experience, physical and mental preparedness to act, and careful monitoring of interventions. These are the same, again, as our previous section. These empirical indicators allow a nurse to identify the presence of vigilance in his or her nursing practice and make adjustments to increase the level of their patient care. And so these are the three things that we can grab a hold to and actually measure, using the knowledge and experience, being prepared to act, and monitoring those implemented nursing interventions. Next section is our operational definition. This is in reference to our theoretical definitions previously stated. Operational definition is a statement of meaning that indicates how a term or concept can be assessed empirically. That's how we can grab a hold of this idea and actually measure it. So this is what is observed in relation to our theoretical definition. This is measured and observed by focusing on the consequences and the outcomes of patient situations. And this is our operational definition. It's the measurement of patient outcomes after rescue events in which the nurses have adequate knowledge, experience, and resources to provide vigilant care. And that's how we measure vigilance in nursing. All right, and in summary, thanks for watching our presentation. I'm going to close with a few different thoughts and just an overview of the whole project. Okay, again, a vigilant nurse is one with sufficient knowledge, experience, and resources who is physically and mentally ready to utilize their skills to implement and monitor appropriate nursing interventions. Nursing vigilance is considered a core element to nurses' practice. And we're going to end with a quote from Florence Nightingale in her Notes on Nursing. For it may be safely said, not that the habit of ready and correct observation will by itself make us useful nurses, but that without it we shall be useless despite all our devotion. So let us all be vigilant nurses.